Hey everyone, today we're diving into a topic that affects many men as they age, which is benign prostatic hypertrophy or BPH. So, what is BPH? BPH is when the prostate gland starts to enlarge, typically when men hit their mid 40s. By their 60s, more than half of men have it, and by 90, nearly all do. The prostate, which is about the size of a walnut, surrounds the urethra, the tube that carries urine out of the body. As it enlarges, it squeezes this tube, making it difficult for urine to pass. So how does BPH affect urination? Imagine trying to squeeze water through a garden hose with a kink in it. It's tough because of the pressure from the growing prostate. The bladder can't empty completely, so men end up needing to urinate more often day and night. If left untreated, the bladder can become overly full, leading to urine leakage or incontinence. The good news is that there is an effective procedure known as the transurethral resection of the prostate, which can help with this. No cuts are needed. A scope is inserted through the urethra to the prostate, where it trims away the tissue that's blocking urine flow. It's like clearing the kinked section of the garden hose so water can flow freely again. The prostate is positioned in the pelvic cavity nestled between the bladder and the penis, surrounding the first part of the urethra. It's encased in a fibrous covering and consists of smooth muscle and glandular tissue made of columnar epithelial cells. As BPH progresses, the gland's outer capsule thickens but becomes less attached to the underlying tissue, making it easier to separate during surgery. So, what exactly does this gland do? The prostate secretes a thin, milky fluid that makes up about 30% of semen. This fluid isn't just for show. Its slightly milky appearance isn't just aesthetic. The prostate's secretion plays a vital role in protecting sperm. Here's how. The fluid is slightly alkaline, which helps create a favorable environment for sperm when they enter the acidic vaginal canal. This little shift in pH is crucial because it keeps the sperm healthy and more likely to survive their journey. But that's not all. The prostate fluid contains a clotting enzyme. Why is this important? This enzyme helps thicken the semen once it's inside the vagina. This thickening action helps keep the semen close to the cervix, enhancing the chances of successful fertilization. Think of it as a strategic maneuver to get those sperm right where they need to be. So, next time you think about the prostate, remember, it's not just sitting there. It's actively optimizing the conditions for reproduction. The exact causes of BPH are not fully understood, but research points to hormonal changes as a significant factor. As men age, shifts in hormone levels, particularly testosterone and estrogen, may contribute to prostate gland enlargement. Several factors can increase the likelihood of developing BPH. BPH symptoms are rare in men under 40, but become more common as they age. By age 60, one-third of men experience moderate to severe symptoms, and this rises to about half by age 80. If you have a father or brother with prostate problems, your risk of BPH increases. Family genetics play a big role here. Prostate enlargement is less common in Asian men compared to white and black men. Notably, black men may experience symptoms at a younger age than white men. Studies show a link between BPH and chronic conditions like diabetes and heart disease. The use of beta blockers common in these conditions might also elevate the risk. Obesity is a risk factor for BPH. While regular exercise can help reduce the risk, maintaining a healthy lifestyle can have a protective effect on prostate health. The problem starts with the prostate, specifically the periurethral zone, which enlarges over time. As this zone expands, it forms adenomas that obstruct the urethra running through the prostate, affecting how the internal sphincter works. This obstruction is what causes the classic signs and symptoms of prostatic obstruction like difficulty urinating. In some cases, the situation can worsen with the formation of diverticular pouches that can become even larger than the urinary bladder itself. These diverticula don't empty properly, leading to urinary stasis. And that stasis can set the stage for three main issues: infections, bladder stones, and in the worst cases, tumors. Imagine trying to push water through a clogged pipe. That's what happens when the prostate enlarges in BPH. The symptoms that follow are due to the obstruction caused by this growth. There is weak urinary flow. The force of the urine stream is reduced. It's like trying to pour water through a pinched hose. The flow is weak because the prostatic urethra is partially blocked. There's also hesitancy in starting urination. Imagine turning on a faucet that takes forever to flow. That's how it feels for someone with BPH. The pain and discomfort from the blockage make it hard to get started. There is also post-void dribbling. Ever felt like you were done, only for a few more drops to follow? Patients often experience dribbling after urination, which can even be smelly, signaling incomplete emptying. There's also a feeling of incomplete bladder emptying. That constant nagging feeling like your bladder is never fully empty. That's because it is not. The enlarged prostate obstructs complete drainage. In some cases, urine cannot pass at all. This is urinary retention, when the bladder cannot empty properly due to the prostate blocking the urethra. There's also hematuria, which is blood in urine. Small blood vessels in the prostate can rupture due to pressure, leading to blood appearing in the urine. There's also dysuria, which is painful urination. So a partially blocked urethra can make urination painful, like forcing water through a narrow tap. There's also the urgency to urinate. That urgent feeling when your bladder is not really empty. The patients feel the need to rush to the bathroom frequently because their bladder never truly empties. There is also nocturia, which is frequent nighttime urination. So imagine being woken up multiple times at night to urinate. The incomplete emptying makes patients feel the need to go frequently, disturbing their sleep. The aims of management are to alleviate the symptoms, allay anxiety, and prepare the patient for surgery. Let us now discuss the investigations in benign prostatic hypertrophy. First up is urinalysis. This test helps us to spot any changes in your urine. In BPH, you might see a reduced amount of urine and an increase in white blood cells. These changes can give us important clues about inflammation or infection in the urinary tract. Next, we look at urine samples under a microscope and culture them to identify any bacteria. This helps us to determine if there is an infection and what antibiotics might work best to treat them. To check how well the kidneys are functioning, we measure the serum creatinine levels. High levels can indicate that the kidneys are struggling, which is important to monitor in BPH patients. PSA, known as the prostate-specific antigen, is a special protein produced by the prostate. We measure its levels to help rule out prostate cancer. Elevated PSA levels can be seen in both benign and malignant prostate conditions. So it is a useful test to assess overall prostate health. Direct rectal examination involves feeling the prostate through the rectum. This exam helps us assess the size, shape, and firmness of the prostate, giving us clues about any abnormalities. We check how much urine is left in the bladder after urination. This can be done with an ultrasound or a post-void catheterization. If there is more than 100 ml left, it's considered high and indicates potential obstruction. Finally, we use uroflowmetry to measure how quickly urine flows. The normal flow rate is about 4 ml per second. If the flow rate is less than 10 ml per second, it may suggest an obstruction in the urinary tract. On treatment, let's start with conservative therapy. These are non-invasive methods that can really make a difference. We have prostatic massage. This technique can help relieve symptoms by reducing congestion in the prostate. Taking warm seats bath can soothe discomfort and improve circulation in the pelvic area. Limiting fluid intake, especially before bed, helps prevent bladder distension and can ease symptoms. If an infection is present, antibiotics or other antimicrobial treatments are prescribed. Regular sexual intercourse is also among the non-invasive methods. So believe it or not, this can help reduce prostatic congestion and improve symptoms. Now, let's talk about medications for mild to moderate BPH. So drugs can play a key role. We have Prosca, which is known as the finasteride. So this medication is a type of androgen that works by blocking the conversion of testosterone. The result is a smaller prostate. However, Keep in mind it may cause side effects like impotence, decreased libido, and reduced ejaculation volume. Adrenergic antagonists we can also give in mild to moderate BPH. These help to relax the muscles in the prostate and bladder neck to ease urinary symptoms. Some commonly used ones are Hytrin, Cardula, and Flomax. Let's talk about the complications of benign prostatic hypertrophy. First up, let's talk about urinary retention. This happens when the enlarged prostate blocks the flow of urine. Imagine trying to pour water through a narrow straw. It's slow and can get messy. This obstruction can cause urine to accumulate in the bladder, making it a perfect breeding ground for bacteria. This leads to urinary tract infections, which can be quite troublesome for patients. Next, we have hydronephrosis. Picture a traffic jam on a highway, causing a backup of vehicles. Similarly, when urine can't flow out of the bladder due to blocked prostate, it backs up into the kidneys. This causes the kidneys to swell, a condition known as hydronephrosis. Over time, this can damage the kidneys, so it's essential to address the blockage early on. Moving on, let's discuss hydroureter. This is similar to hydronephrosis but affects the ureters, the tubes that carry urine from the kidneys to the bladder. Just like hydronephrosis, if the flow of urine is obstructed, it can cause the ureters to swell. This condition needs careful management to prevent long-term damage. Finally, let's talk about renal shutdown. If the problems caused by BPH aren't managed effectively, the prolonged pressure and backup of urine can severely impact kidney function. In the worst case scenario, this can lead to renal shutdown, where the kidneys can no longer filter waste from the blood. This is a serious condition requiring immediate medical intervention. What's the big deal about surgical treatment? Surgical intervention is often seen as the go-to solution when other treatments fall short. It's a game changer for several serious urinary tract issues. But why? Let's break it down. So when there is acute urine retention, imagine your bladder is like a balloon that's getting overfilled. When it's unable to empty, it can be extremely painful and dangerous. Surgical options are often needed to relieve this pressure and get things flowing smoothly again. When there is hydronephrosis, this is when the kidneys swell up due to urine not being able to drain properly. Think of it like a traffic jam on the highway. Everything gets backed up. Surgery helps clear the way and protect kidney function. When there is severe hematuria, so seeing blood in the urine can be alarming. In cases where bleeding is heavy and persistent, surgery might be required to find and fix the source of the problem. When there is recurrent urinary tract infections, you find that some people suffer from UTIs repeatedly despite taking medications. Surgery can sometimes be the answer to preventing these infections by correcting underlying anatomical issues. Not only that, surgery can offer palliative relief. So for those with intolerable symptoms that cannot be managed through other means, surgery might provide much needed relief, and improve quality of life. So, why should you care? Understanding these surgical options not only helps in clinical practice, but also sharpens your diagnostic skills. Knowing when surgery is necessary versus other treatments is key in providing the best patient care. Key takeaways from this is that BPH is common and manageable. So, as future healthcare providers, understanding BPH means being prepared to help your patients navigate their symptoms and treatment options. Thank you for watching. If you found this helpful, be sure to like, subscribe, and hit that bell icon for more to easy understand medical content. See you in the next video.